So my name is Charlotte Gray. I work as a public health researcher for Public Health Wales, and I'm going to talk a little bit about a report that from some research that I did with a colleague, Louise Woodfine, who's sitting in the back, over the last year. And the report, it's available on the website. There's also, I put some on the table. There's also been an infograph launched today. Again, it's available on the website. And if you put the hashtag for the event today, you'll find a tweet with a link to it online. And So I come from a public health background, that's my interest, and we just want to introduce a little bit the background to why we did the research. Homelessness, it's a public health concern. We know that the home is a stabilising factor. Good quality housing and a sense of belonging is absolutely fundamental to health and well-being. And there's benefits to health from having a house, such as access to employment and education, which if you're living on the street or in unstable housing, you just can't access. And this reduces health inequalities. And inadequate housing, including homelessness, it both directly and indirectly affects people's social, physical and mental health. And homelessness, it's really an indicator of fundamental breakdown in a person's life and an extreme form of social exclusion and inequalities, coming back to the word inequalities again. There are different types of homelessness. You've got the rough sleepers, the people on the street that most people would think of, but actually it's that lack of adequate housing. It's living in substandard and unsuitable housing. It's having no right to stay. It's the hidden homeless, and that's particularly the case for young people and women. If they are homeless, you often won't see them on the street, but actually they have nowhere to live, but they're staying with friends and family, or picking up someone for the night to have someone to stay, which I've heard of as well. And homelessness, it can be chronic, it can go on for a long time, it can be episodic, it can be on and off, as well as a one-off because of something that's happened in an individual's life, such as a marriage breakdown. As Peter said earlier, the causes of homelessness. You have your structural factors, you have the things that policy can do something about, things like a lack of affordable housing, unemployment, changes in social support. But you also have these individual factors which are underlying all of it and really are sort of interacting with the structural factors. And these are things like a disadvantage, so poverty was spoken about, but also that's ill health, a lack of education. Things like life history, so that's things that happened within your childhood, adversity in your childhood, for example, or childhood poverty, or life events such as a family breakdown. So this could be a breakdown of a young person's relationship with their parents or within an intimate relationship as an adult. And again, Peter mentioned earlier, those at greatest risk of homelessness, and this links very strongly in with these individual and structural factors, people leaving an institutional environment, so care leavers, people leaving prison, people living in childhood poverty, people with minimal social support, people with dysfunctional families. So ill health, it's a cause and a consequence of homelessness. The homeless population, they have a high proportion of multiple health issues, as well as ill health contributing to becoming homeless. So individuals with issues such as mental illness, physical illness, substance abuse, for example, are more likely to become homeless. And then, whilst they're homeless, their health and well-being deteriorates more rapidly, and this contributes back to ill health. And it's this real bidirectional relationship that's also linked in with social exclusion and health inequities. We know, or reports have indicated, that people that experience homeless, they're more likely to use NHS services. There's a report that suggests they're 4 times more likely to have increased use of A&E, or 8 times more in unscheduled NHS costs compared to the general population. There's also real barriers to accessing healthcare. If you don't have a home, it's actually very difficult to go and see your GP. A lot of GPs might not let you go there without an address that you can then register with them. As well as issues with getting appointments, for example, in hospitals. If there's nowhere to send a letter, actually, how do you know when your hospital appointment's going to be? And the ONS came out with figures last year, and we know that people who sleep rough are more likely to die prematurely compared to the general population, and really shockingly so. Their figures were that the average age of death of someone experiencing homelessness was 44 years for men and 42 years for women. And you can see that the figures they compare to with the general population, it's 30 years younger. It's shocking, absolutely shocking. And we know that dealing with homelessness, it's incredibly complicated. It's not just looking for implementing effective solutions to prevent homelessness and all the things that policy have been talking about, but actually you also need to deal with the multiple complex causes. So it's about having the affordable housing and making sure the tenancy can be maintained, but it's really understanding why the tenancy cannot be maintained. And that's where looking at childhood adversity is one of the things that can be a barrier for this. As Emma mentioned earlier, childhood disadvantage, it can set people up to fail. And I'm going to be explaining my thinking behind this. Homelessness is more likely by childhood adversity. There are studies from America, there's research from Shelter Cymru that suggests that actually if you're growing up in a house where there is childhood trauma going on, you're more likely to become homeless, and that the homeless population often have, or more than often have, multiple adverse experiences. And what we're talking about with these adverse experiences, that's a real buzzword, ACEs, adverse childhood experiences. And what these are, if you haven't heard of them, they are children growing up in a household where they are both directly and indirectly exposed to trauma. And these traumatic experiences can be childhood abuse. It can be physical, mental, and sexual abuse towards the child. It can be neglect, so physical and emotional neglect that they're growing up with. It can also be experiences that are more indirect within that home environment, so parental separation, an adult in the home with substance abuse, alcohol abuse, mental illness, or growing up in a household with domestic violence. And we know that ACEs have a long-term impact on health and well-being, and that they are a risk factor for later violence, substance misuse, alcohol misuse, and mental illness, and also with poor health. And all of these are factors that are also associated with homelessness. And we know that exposure of the child to this social disadvantage, it means that they are less likely to be able to adapt successfully and more likely to adopt maladaptive coping behaviour, such as growing up and then having substance abuse themselves, or going back into that cycle of having a dysfunctional relationship as an adult. So going to sort of recapping that homelessness, it is a complex social and public health phenomenon. It's beyond just bricks and mortar, and understanding the social element is key to prevention, not just having a home. So the research that Louise and I did last year, we wanted to understand a little bit more about the relationship between these adverse childhood experiences and homelessness in Wales, so we could understand a little bit more about what early intervention might mean from this sort of ACEs approach. Well, what we did was, Public Health Wales loves ACEs. We've done a lot of work on ACEs, and what we did in 2017, there was a national survey of 2,500 people across Wales trying to understand their childhood experiences. So they're recalling back to their childhood and what they had experienced. And as part of that, there was a question in there. It was very basic, but since the age of 18, has there been a time in your life where you considered yourself homeless? Yes, no. And this is very much self-reported homelessness, very open-ended definition for it. At the same time, we also measured resilience assets in childhood using a validated measure. And as well as looking at this sort of data set, we also went and we did some interviews. We spoke to 27 people who had lived experiences of homelessness. We tried to mix it up so it was a bit more of a mixed group. So I spoke to 9 young adults, about 10 adults who had children not necessarily living with them, and 8 single adults, as well as talking to 16 services, and Louise was the person that did that. And the services we spoke to, we tried to identify them after the interviews with the homeless population had started, to try and understand, actually, through a person's life course, which are the different services that the person's actually interacting with, so as a child and through their life. And the services we spoke to included primary schools, secondary schools, primary care, so GP, health boards, Department of Work and Pensions, a clinical psychologist, social work, housing organisations, homelessness charities, and youth services. And what we found from the big data set, we found that when we did all these calculations to try and make it, adjust it for the population of Wales, that 1 in 14 people had come in this survey and said that they had lived experience of homelessness. That's incredibly high, that's 7%. From the survey, it was not quite 50-50, but about 45% of these were males and 55% females. And it was more common in the more deprived areas in Wales. So if you lived in the most deprived quintile of Wales, you were 4.2 times more likely to report having had these homelessness experiences. And this really does link back with what's been said earlier, that poverty is really important for homelessness, and many reasons why. We looked at the different ACEs within the survey, and the ACEs are more common in the homeless people that have experienced homelessness compared to the general population. Looking at the separate ACEs, you can see that 49% of people who reported this lived experience of homelessness had also grown up in a household with domestic violence. 20% had grown up in a household with physical neglect. 56% in a household with verbal abuse. And throughout all these figures, it is higher than the general population. So looking at the ACEs, people like to group the ACEs together into 0, 1, 2, 2 to 3, 4 and up. And this makes it nice to try and understand, because the ACEs are very interrelated, and if you have one, you are more likely to have a second one, and it gives a pattern of dysfunction growing up. But what we found was, compared to the general population, and there you can see the yellow bar at the top is the population of Wales, the blue bar is people with a lived experience of homelessness. And 87% of people with these lived experience of homelessness had had more than one ACE, compared to only 46% of the general population. Now, when you're looking at 4 or more ACEs, so a higher proportion, half of the people with lived experience of homelessness had had these 4 or more ACEs, and only 11% of the general population. And again, looking at the figures, compared to people with no ACEs, those with 4 or more were 16 times more likely to go on and report a lived experience of homelessness. However, when you then consider these childhood resilience assets, this actually did seem to have a protective effect and reduce it by half. And when we're talking about childhood resilience assets, the measure that was used was looking at things like education being important, feeling of belonging to the school community, having a supportive family or friends, being able to complete things. It is just a measure, but there does seem to be a protective factor. So with the interviews that we did, one of the common themes that came through all the interviews, no matter what the age, no matter what the gender, was that actually there seems to be a sort of pattern going through the life course. And what I was finding was that people that were talking about their experiences as a young child, they're talking about the ACEs and the challenges they're facing at home. And of all the people I interviewed, everybody had an ACE, and a lot of them had up to 10, 11 ACEs. They had a huge number. And the home environment was incredibly chaotic in many ways. The child growing up in this chaotic environment, often they were explaining that actually, as they were growing a little bit older, they realised that the home they were growing up with was so different to their friends. And the proper part of the thing that there seems to be this pattern of, that the child is really normalising all these experiences. They don't know it's different until they start to grow a little bit older. They're going to later primary school, secondary school, realising actually if they're going in and they aren't being treated for lice, they've got shabby clothes, there's issues going on at home, that this isn't normal, their peers are not necessarily experiencing the same. And these individuals seem to sort of cope relatively well during primary school. As they're hitting secondary school and becoming teenagers, more aware of the world around them, actually having this a greater challenges between the pressures of school and their peers there compared to all the pressures at home. and finding life a little bit more difficult. There seemed to be this pattern of acting out at school, not being able to stick to school and getting a good education. A couple of individuals were saying we started in year 7 and we were in the top set, but actually by year 8 we dropped down to the bottom. We weren't attending class, we were acting out, getting sent out, excluded, starting with drink and drugs. And this was not quite a sort of a pattern going through, making it incredibly difficult, then leading to not have this poor school attendance, actually children being very able, not getting that support, leaving school without any education, and then as adults, then this sort of maladaptive coping behaviour continuing with sort of drinking and the drugs and all these mechanisms that they've learnt from their parents or their family group growing up, but also as a response to being able to deal with what's been a very traumatic childhood. And a feeling of not belonging anywhere. So what my feelings were on this, that actually universally, not all children, most children go to school. And actually these early years in schools, as well as having a trusted adult, it really is critical to supporting these. So young people generally have just a few
my name. Not she. Truth, I've never should have been telling them for years. But I had nowhere to. So from services were that I was told mental most of the recipients had struggled issues of LGBT with poor mental health for aging people may well have prevented trauma. Instead, experiences cry bad person worst experiences. They their advisor. Interview thought was LGBT